This video is brought to you by life insurance that you can get in as little as 5 minutes by going to metkevin.com/life, and they're writing policies during the pandemic. Okay, folks, we need to talk about Omicron because I really believe the hedgies are shorting small cap stocks as a way to protect from uncertainties around Omicron. And I found this very interesting. The airline industry has been freaking out because people are being recommended to isolate for 10 days after testing positive with COVID and Omicron, but Omicron has a substantially shorter symptom period. And so now the CDC, right after big business, is like, come on, CDC, change the guidelines. Sure enough, the CDC today lowered the recommended isolation period for asymptomatic people from 10 days after testing positive to 5. But who is asymptomatic is not determined by a doctor or a testing center, it's determined by you. So if you feel asymptomatic, you only have to isolate for 5 days. But if you want to get, more paid time off because you feel sick, then I guess you got to stay home for 10 days from work. That's not helping the airline industry be very happy. That's leading to some confusion, which honestly, the CDC and confusion, I feel like these things go hand in hand. We also have the following chart, which is not so great. It is from the Department of Health and Human Services. These are where we stand with COVID case counts. Obviously, you could see the surge is here. The top gray dotted line is 200% of the peak of the last COVID peak that we had last winter. You could see DC well over 200%, New York well over 200%, New Jersey well over 200%. So that, like the tri-state area, ouchies. Puerto Rico jumping, Rhode Island climbing up there, Delaware climbing up there. I mean, look at some of the pain that you're getting here on these charts. Even Hawaii is having the explosion in cases. I did think it was interesting that New Hampshire's already kind of peaked a little bit and started to rotate down. Now, what we do need to do is we need to talk about the United Kingdom. What's happening in the United Kingdom? First, you got to be careful. Don't just Google United Kingdom case counts of COVID because you're going to see an inflection point to the downside, but that's because Google has not updated the COVID cases yet, and I recommend maybe don't use just Google. Don't just rely on Google. There are two places that you can watch for COVID case counts on. One is covid.joinzoe.com, and the other is Our World in Data. We're going to look at both of these and look at some of the latest numbers. We're going to keep an eye on those hospitalizations as well. Keep in mind some of the expectations. In South Africa has about an average population that is around 10 years younger than that of the United States and the United Kingdom. On top of that, we are in a situation where many more individuals in South Africa were previously exposed to some form of coronavirus or have been vaccinated than really the United Kingdom or the United States. That means there's a much larger unvaccinated and unexposed population of individuals in the United Kingdom and the United States. And some believe that could mean we could end up having a more severe outbreak of Omicron, though fortunately so far, studies are indicating, and knock on wood, that this is a much more mild disease. But let's look at the numbers nonetheless for the United Kingdom. All right, here we go. This is a chart. It's an interesting one. It's a chart of the number of people calculated to have COVID symptoms. And right now, we can see that this chart is not letting up. The latest piece of data that we have here is that the United Kingdom is predicting across the United Kingdom a total case count of 1.9 million in terms of number of predicted cases. Now, that's not where we stand. Right now, we technically stand at 183,000, but that's because they believe more than 10 times the number of actual recorded cases are actually individuals who are sick. That means for every one person who gets tested, there are probably another 10 who are sick with Omicron, don't know it, aren't getting tested. So we're going to get exposed with Omicron. In fact, you might be watching this and you might hear some people around you with some sniffles or a cough. They could have the Omicron. It is insane, the predictions here. Now, if we jump on over to Our World in Data, fortunately, we're seeing only modest upticks in hospitalization in certain areas. Take a look at this. We're seeing a small uptick in hospitalizations here in Spain from about 6,422 to 7,815. Now, that's that's just over a 1 day period of time. So that's actually a decent uptick there, a larger movement there. But otherwise, we're relatively flat, slow gains here on hospitalizations increasing. If you take a look at Italy, we went from 10,309 to 10,849. So we're definitely seeing an increase of new hospitalizations. Now, usually we like to say, but they could be coming to the hospital for a different reason, then they get tested and they have COVID. Yep, that is definitely possible. And fortunately, we have a particular chart for this. What is the weekly number, okay, this is important, weekly number of new hospitalizations due to COVID? This is such a critical chart. We cannot understate this. Let's zoom into it so we can get the best understanding just by trying to get in on December here. That way we can get the clearest look. Hospitalizations in the United States due to COVID is still rising. Over the last 4 days, we went from 59,400 to 65,900. That's almost an 11-12% increase here. That's not great. Quick reminder to go to metkevin.com/life to get a life insurance policy in as little as 5 minutes. You can Apple Pay for it, Android Pay for it, and folks, it's easy to do. Write your beneficiary in and get yourself life insurance. Go to metkevin.com/life. However, this is quite possibly because of the Delta surge still lingering in the United States. Even though Omicron is now over 80% dominant, we still have lingering cases of Delta, and there's quite a good chance that is why we're seeing this increased hospitalization. So hopefully we start seeing that hospitalization count start curving to the downside, inflecting to the downside. Kind of like what we had over here in the Netherlands. The Netherlands had hospitalizations plummet from about 1,800, and they had a pretty severe Delta surge, all the way down to now 1,100 in just the last couple of weeks here. We're not really seeing an inflection point up anywhere except for in Spain, where in the last 12 days in Spain, we've gone from 4,778 hospitalizations due to COVID to 7,284. That's quite a chunk more, 4,700 to 70, almost 300, 4,700. That works out to about a 50-ish% increase in the number of COVID cases in hospitals due to COVID. So we want to watch Spain and we want to watch the United States. The good news is the United Kingdom so far relatively flat. However, we don't have the latest hospitalization data yet from the United Kingdom. This ends on the 20th. So we're looking for another update on this within about the next 24 hours so we could get a full week of data from the United Kingdom, and we don't want to see an inflection point to the upside on Omicron. Okay, now, it is worth noting that there's a lot of drama happening right now because of Joe Biden. That is because in regards to a COVID question, Joe Biden mentioned the following, quote, "There is no federal solution. This gets solved at the state level." Now, this is a problem, and Joe Biden is trending on Twitter for this because this is what Joe Biden sent right before the election of 2020. Joe Biden said, "We're 8 months into this pandemic and Donald Trump still does not have a plan to get this virus under control. I do." Well, now Joe Biden's saying there is no plan. Obviously, well, maybe it's not obvious. I believe Joe Biden is trying to suggest that it's states' responsibilities to handle their own crap. But let's be real, Joe Biden suggested he had a plan, and quite frankly, there is a lot the federal government could do, including, and not limited to, distributing proper N95 masks to individuals. I do not have any investments in N95 companies. I do not get sponsored or affiliate links or whatever for N95 masks. I just highly recommend that if you do want to be protected, even from getting a cold, okay, whatever, if you don't want to get sick and you're going to be in a really populated area and you want to have a good mask, I highly recommend just type this into Google. I encourage you to do it before they're sold out. And again, I'm not even using an affiliate link because I do not want you to think I'm trying to make money off you buying these masks. I'm just trying to offer you this service. Type into Amazon N95, N, not KN95. Those are the Chinese version, lower standards. I tell you, I can never visit China. They're probably going to kill me if I go there. But anyway, box of 20, $22. Get these right here, flat. They go over your head. They don't go behind your ear. The ear ones are a little bit more comfortable, but these are pretty good. And they have a little foamy by the metal band as well. They're great. I just got mine. The price of them has kind of been ticking up though a little bit. But anyway, No Plan Joe is now the number one trending, or has been the number one trend on Twitter. Again, this is my opinion. The government should be sending N95s to people, not just tests. But whatever. And they're expensive, okay? $1 a mask. Jeez, you don't have to wear those a few times. Anyway. COVID hospitalizations have also been rising to a new high in New York. We're now over 5,500. We're seeing an uptrend towards children being hospitalized due to COVID, not with COVID. We went from 22 children hospitalized on December 5th to 109 hospitalized, or about 5x, ending the week of the 23rd. Now, none of the kids that are hospitalized now or were hospitalized due to COVID have been vaccinated. Again, there is possibility that we still have a little bit of a Delta overhang here. This is despite the fact that children were eligible to get vaccinated as of November 3rd. However, so far, only 16.4% of children aged 5 to 11 in New York City are actually fully vaccinated. 27% have had one dose. Kids 12 to 17 are about 75% vaccinated with at least one dose. So unfortunately, this surge came before more it could get vaccinated. But then again, a lot of folks are saying, hey, you're still going to get it. Now, would that have prevented these hospitalizations? Possibly. Obviously, that is what the vaccine manufacturers tell us. That's what studies tell us. But I know many of us listening to this kind of data are exhausted by research at this point. And you know my stance. I'm pro-choice. I do recommend you get vaccinated, though. I'm not paid to say that either, and I don't own any money in vaccine stocks. It's just my belief. I'm just being fair, but I'm not going to force it on you, okay? I respect you. Anyway, according to Johns Hopkins, the U.S. has an average right now of about 194,000 cases per day. That's 47% higher than where we were a week ago. And deaths are also up about 17% over the same period, but again, probably some Delta overhang here. Australia also had its first death linked to Omicron. That death was, listen to this, folks, in a fully vaccinated man in his 80s living in a care home with underlying health conditions. Unfortunately, this is the only information that we have, but this is one of those sad cases where somebody who was vaccinated did try to go out of their way to do the right thing, did end up dying, very likely from Omicron, though they did have other underlying conditions. Now, Dr. Fauci is recommending that we have a travel vaccine mandate for flights. This is obviously not very popular. A lot of airlines sunk in stock trading today, partially because of this. We have Israel starting their trials on their fourth COVID shot already. 150 medical workers have participated in the trial and have received their fourth booster shot. It's because a lot of people got their first boosters, so their third shot, in the summer. Well, now we're 6 months past that already, right? So here come the never-ending chain of shots, whatever. And on top of this, and this was a little morbid, this research did not include any mention of Omicron. I went through the actual statistics and the actual research report. But in a paper published by scientists at the U.S. National Institute of Health, they found that COVID, coronavirus, this particular COVID-19 is capable of replicating in human cells, quote, well beyond the respiratory tract, that the results indicate a delayed viral clearance as a potential contributor to persistent symptoms for long COVID sufferers. In other words, because it takes so long to get this disease out of your body completely, it could be causing COVID long in people, and kind of explains why some people have these lingering feelings of fatigue or heart issues or brain fog. The paper also tries to help explain why some people have mild or asymptomatic COVID but still experience long COVID. Now, this paper has not yet been reviewed by independent scientists, but the research, which is based on a sampling of 44 patients who died after catching COVID, in other words, they were sliced up and studied, shows that COVID was found in multiple parts of their body throughout the brain as much as 230 days after catching COVID. You still got that thing lingering inside of you, sucking the life out of you. Ugh. The study also provides data supporting previous research that COVID directly kills heart muscle cells, and those who survive may suffer cognitive deficits, according to the University of New South Wales. Researchers suggest that infection of the pulmonary system may result in an early essential phase where the virus is present in the bloodstream and is then seeded through the entire body, including across the blood-brain barrier, even in patients experiencing mild COVID symptoms. So, wow. No talk about Omicron in this. But this is something that Omicron hasn't been around long enough for us to determine this, but this is something that a lot of people are nervous about with Omicron. It's like, look, I'm not so worried about the cold. It's just, am I going to end up with long COVID, right? And we have that brain fog or fatigue, even for 3 months. That sucks. It takes work out of your schedule, and that means less dollar hollers for you. Anyway, folks, thank you so much for watching this video. If you found it helpful, consider sharing it, and I appreciate you. And folks, we'll see you in the next one. Thanks so much. Goodbye.